So I'm knocking on the door and checking the sign to see if I need to put on any PPE clothing. I'm entering the room. Hello, Dawn. I'm Abby. Today I'm your CNA. I will be giving you perineal care. I'm going to ask to see her wristband, ask her when her birthday is, make sure that they match. Also that her name matches the same on the wristband. I'm going to wash my hands. I'm going to collect the items that I need. I'm going to put a paper towel on the overbed table and put my items on the overbed table. And then I'm going to close the curtain for privacy. I'm going to lower the bed to where, to use good body mechanics. I'm going to make sure that the other side bed rail is up, and then the side that I'm on, it is down. I'm going to wash my hands and put on gloves. I'm going to cover my patient with a bath blanket and move the top linens to the bottom of the bed. I'm going to position my patient on her back, and I'm going to drape my patient. So the one corner is going to be facing this way, one corner that way, one corner that way, one corner down. It's going to be like a diamond. So then I'm going to fill my wash basin to about 105 to 109 degrees, or depending on what the care plan says. I'm going to also make sure that the temperature is comfortable for my patient. And if it's not, then when I do go fix, I need to make sure that that bed rail is up while I'm away from the bed. I'm going to place the basin on the overbed table, and I'm going to lower the bed rail if up. I'm going to help my patient raise her knees and spread her legs, and then I'm going to fold this part of the bath blanket around the leg and place it on the abdomen. So then I'm going to place a waterproof pad underneath my patient's butt and remove any wet or soiled products. I'm going to remove those gloves, wash my hands, and place new gloves on. Then I'm going to wet my washcloths. I'm going to squeeze out. Every time I make a stroke, I'm going to be using a new washcloth. So I'm going to rinse out the washcloth, put soap on it. First, I'm going to start with the labia. So I'm going to separate the labia, clean one side, discard, new washcloth, clean the other side of the labia. And each time I'm putting soap on and squeezing the washcloth out. So I'm discarding that. Now I'm going to clean the vaginal area. So new washcloth, clean the vaginal area. And then I'm going to discard of that. And then I'm going to dry or rinse the perineum area. So I'm going to squeeze out my washcloth and go from the one side of the labia, discard, rinse the other side, discard, and then I'm going to rinse the vaginal area, discard. Now I'm going to pat dry with one of the towels from the front to the back. Every stroke that I make is from the front to the back, so the vagina to, I wouldn't reach the anus yet, but from the vagina down. So I'm going to refold the blanket back between her legs. I'm going to help my patient lower her legs and place her onto her side. Now I'm going to be cleaning the rectal area. So I'm going to apply soap to a clean mitted washcloth, and I'm going to clean from the vagina to the anus as needed as possible to make sure that it is all clean. And even though I'm cleaning the same part, I'm going to be discarding the washcloth after each stroke. So I'm going to make sure that it's clean, discard my washcloth. Now I'm going to rinse the rectal area. So I'm going to take my clean mitted washcloth, squeeze it out, and rinse as much as needed. And then I'm going to discard of that. I'm going to pat dry the rectal area, still from the vagina to the anus. I'm going to discard of that washcloth. I'm going to remove the the waterproof pad. I'm going to remove my gloves, discard of them, wash my hands, and put on clean gloves. I'm going to provide clean and dry linens and any products that they need. I'm going to reposition my patient back on her back. I'm going to cover my patient, remove the bath blanket. I'm going to ask if my patient's comfortable, if she needs anything else from me today. I'm going to place the call light and anything else that my patient needs. I'm going to lower the bed to a safe and comfortable position. I'm going to follow the care plan on if the bed rails need to be up or down. I'm going to empty, clean, rinse, and dry my water basin. I'm going to use paper towels for drying. I'm going to return the basin and the supplies back to where they belong. I'm going to wipe off the overbed table with paper towels. I'm going to remove the privacy screen. I'm going to check the room for safety to make sure that nothing can harm my patient, like a toothbrush, mouthwash, toothpaste, any sharp objects, etc. And I'm going to follow the policy to discard of my used linens. I'm going to remove my gloves, wash my hands, and leave the room to report and record my observations.